recorded on location at Aspen Ideas Health in Aspen, Colorado.
Margaret, I was surprised to hear that the U.S. wellness industry now generates $2 trillion in revenue. That's the same number that we spend on Medicaid and Medicare in a year. So that was kind of interesting. On online influencers and are driving a lot of that interest, of course, but who are these health and wellness influencers and how skeptical are Americans of their advice?
It means that the majority of health and wellness influencers don't have that medical training, don't have that medical background. So they instead are promoting themselves for either what they can do, like they can be a coach for people, or what they've done in terms of being an entrepreneur and creating this product in the health or other space.
Well, we're going to learn about this because our guest today is Galen Stocking. Galen is the Associate Director of Research on the Science and Society team at Pew Research Center, and Pew has just released a new poll about health and wellness social media influencers.
We asked audiences what they actually remember hearing about and how different that is from the information they get from their healthcare providers. And about 1 in 5 say it's actually extremely or very different from what they get. But twice that amount say it's not at all different or not too different.
This is Conversations on Healthcare. Welcome, Galen.
Thank you for having me. I'm really excited to have this conversation.
We are so glad to be here. We're at Aspen Ideas Health, and we're having a very enjoyable time. Lots of good communication going on. You did a great session today.
Oh, thank you.
Very informative.
Absolutely.
And to that point, you have new research about health and wellness influencers who are on social media and local podcasts. But before that, why did Pew take this on, and who funded it?
Well, all of our funding tends to come from the Pew Charitable Trust. They're our primary funder. Some of our research has other funding, but the charitable trusts are by far our primary funder. But the reason why we looked at this is because we, as an institution, are guided by this idea of essentially holding up a mirror to society and showing them what people think. So that's why we make everything all of our research is freely available to the public and is really focus on people's attitudes and their behavior around how the world is changing, how they're getting information, how they're responding to different things. So we have a few different lines of research that we are focused on that led to this study. One long line of research is how people are learning about new things in the changing information environments. Another line of research that comes out of that is the role that social media and in turn, influencers play in that. Now, we released a report in 2024 on news influencers that this really builds upon, that shifts the focus away from news to health and wellness influencers. And that draws on a separate line of research that we have that's looking at people's personal health and their attitudes about their health, their behavior, and what they're doing. And I think all of that kind of comes together in this report.
Galen, tell us a little bit about the role you play at the trust.
I'm at the Pew Research Center.
Pew Research Center.
So I have been there for a little over 10 years now. My background is in what we would now call data science. I have a PhD in political science and specifically on political communication and how people learn about the environment around them. And so I've used that background and that training to do a whole line of survey research and also research on what people are learning about online, what online sources are saying about news or health or other information. And that comes together. So I helped lead this project with an incredible team that contributed to the knowledge side of what health information is, what we need to be asking about, survey researchers and data scientists that all work together to get to the point that we have here.
How big was the survey sample?
So we did 2 different waves. So 2 different times that we, put the survey out in the field with different questions. Each one was about 5,000 U.S. adults, representative survey, all on our, internal American Trends panel.
Well, Galen, I'm really curious, and this came up in the discussions of a session that I was at today, about how the health and wellness influencers on social media are describing or communicating or vetting themselves, if you will, to the people coming to their sites in terms of their credentials? Is it traditional credentials they're putting out there, lived experience? Tell us about that. What's the mix?
Yeah. So for context here, we looked at 6,800 health and wellness influencers that had at least 100,000 followers on any of Instagram, TikTok, or YouTube. And so that was our sample.
A self-described health and wellness influencer, or is that a category now?
It isn't a category. We had to figure this out on our
Okay.
own. So we had to do keyword searches about health topics, wellness topics, see who came up, vet them. We, started with lists of, I think 40,000 influencers, whittled that down, made sure they were regularly talking about health or wellness, and then from that, we got to about 6,800. And so what we did then, once we had that sample, we said, okay, here is the universe of health and wellness influencers on social media or podcasts. And basically everyone who had a podcast also met that threshold on social media. Once we had that sample, we then looked at their bios on social media or any external websites they have. So, I mean, a lot of people use sites like Linktree to give a little more context about who they are, link to their website and things like that. So we included that information in there. And so from there, we wanted to see how they were presenting themselves. Now, in our survey research, we've shown that people are looking for a lot of like professional qualities in their health information sources. They want people who have a lot of medical expertise. They have medical training. They want people who are transparent about any conflicts of interest that they might have. And they also want people who are easy to understand. So we wanted to see how many people are actually had that medical training and talked about the medical training. And we assume that people who have that medical training, they're going to talk about it. And if they don't, well, we didn't do background research on all of them, but we just looked at what was in their bio. And in part, that's because if you're a consumer and you click through to, you get a video or a post and you're like, oh, who is this? You look at them, you click through to their profile page. That's really all the information you're going to get. You're very unlikely to go and do a Google search for them. So we want to, mimic that experience. And so what we found, I know it was a long wind up to what we found. What we found is that about 4 in 10 are some kind of healthcare provider. So everything from doctors and nurses to chiropractors to massage therapists, physical therapists, dietitians, nutritionists, social workers, all of that fits into that broad healthcare provider category. But when we think about healthcare provider, I think if for a lay person, you tend to think just about doctors and nurses, and that was about 17% of that broad influencer sample. Now, what that means, too, is not just that, doctors and nurses are about 1 in 5 of health and wellness influencers, but it means that the majority of health and wellness influencers don't have that medical training, don't have that medical background. So they instead are promoting themselves for either what they can do, like they can be a coach for people, or what they've done in terms of being an entrepreneur and creating this product in the health or other space, or drawing, as you mentioned, on their lived experience. When if they have gone on a weight loss journey and they can help you go on yours, or they have some kind of medical condition and they deal with it in their everyday life, and they're explaining these things and reaching out to people who also have those kinds of medical conditions.
Can I assume that they offer different types of information than healthcare providers did?
We haven't yet looked at what the influencers themselves are saying. Instead, what we have now is we've looked at, we asked audiences what they actually remember hearing about and how different that is from the information they get from their healthcare providers. And about 1 in 5 say it's actually extremely or very different from what they get. But twice that amount say it's not at all different or not too different.
Really?
So yeah, and then the rest are in the middle. So about 60% are in the middle, I believe. So what that's saying is that for most people, it's a little complementary to what they're getting from healthcare providers. And you can imagine, and this we don't necessarily know what all these things are, but you can imagine you might not go to your doctor for every single bit of health information you might need. You might not go to your doctor if you want to say like, oh, I want to try this new diet, or I want to try this new fitness routine. In fact, fitness and weight loss were the top 2 topics that people said they tend to see. But you might go to a doctor for more serious things. So that difference, that lack of difference for most people suggests that it's more complementary than replacing doctors entirely. And indeed, 85% of the public says that they are getting health information from doctors at least sometimes, and that's more than any other health info source we asked about.
Mm-hmm. So you're describing really a very large study. Actually, when you talk about the 40,000 influencers, I think you used that figure earlier.
Came down to 68.
Came down to 68. We didn't
Right, but,
40,000. Yeah.
It consumes a lot of resources to do this kind of research and do it carefully. And Pew has a great reputation, so we know that you're taking the research seriously. I'm really curious, though, what drove somebody at Pew to say this is something important for us to look at? What was convincing to the people who make the decision to allocate the resources? Because we all know there's no shortage of things to look at these days in health and society, and that's really your approach, right? What is important,
Mm-hmm.
science and health and society. So share with us a little bit about what was the compelling argument? What did you see going on in the country that made you say, we need to understand this?
Well, I think part of it started with I also conducted the news influencer study in 2024, and seeing, right around the 2024 election, when that election was largely in after the post-election, people talked a lot about how this was the influencer election. And we really started studying right around that time, right after the election concluded. And we saw the importance that news influencers were playing in that capacity, in that topical space. Mm-hmm. And we also saw just how prevalent wellness actually is as something that's important to people, and that this is a source for information for people. And so we wanted to really put some numbers on that and really be able to say like, 40% of Americans say that they're ever getting health and wellness information from influencers. I mean, that's an important backstop point to say and understand about.
That's a force in society,
right? That this is something that's driving people's healthcare decisions, their consumer decisions in the health and wellness space. And we want to be able to put that marker down and be able to continue to follow that as part of our research.
And I assume when technology changes, you'll continue to measure the impact that it's having, right? Because we've have social medias since the iPhone. We've seen this enormous jump. But I am interested in one sort of element here. And we know a lot of people who are older who've been influenced by fraudulent calls, right? People who are calling up and selling them something that, they shouldn't have had. And yet you found in your poll that older people were more skeptical about the information they were receiving versus younger people, which is sort of the reverse of our own experience, which is that you can pitch older people something that they shouldn't be sending you money for. But in this case, it seemed to be the reverse.
Well, I think one element here is that younger people are more likely to be getting information from health and wellness influencers in the first place. And those numbers are for people under 50 is around 50%. For 65 plus, I don't recall right exactly, but it was in the 20 to 30% range. So pretty large gap there. The other point I would point to in a separate study, when we asked about how difficult it is to understand or to know what to trust when you're getting health information, not just from health and wellness influencers, but from anybody. Right. Younger people had more difficulty understanding what to trust than older people. And some of that goes with experience and also the sources that they use. And of course, younger people, as I just said, are more likely to be getting information from health and wellness influencers.
They're not sitting around at 6 o'clock watching the nightly news.
I don't know many who are. Maybe they are. But
is there still nightly news at 6 o'clock?
People are still buying commercials for it.
I'm curious, in doing the research, did you interview people who use social media, or were you watching the trends mostly based on data? Who were you interviewing?
So it was a representative survey, but we weren't personally interviewing. It wasn't qualitative research in that capacity. We also, when we looked at the influencers themselves, it was all just looking at their bios and their posts. We weren't doing a lot of outreach. That doesn't mean that we didn't talk to a lot of experts in advance and some influencers to try to understand the space a little bit better as we're designing our questions and building out our hypotheses of what we expected to see.
My reason for asking is it's one thing to go to a site, read listen, understand, and then another to take action, right? To
Sure.
follow
Sure.
the advice or the recommendation or mimic the story. Did you get any sense that this is actionable data that people are getting, or actionable ideas and advice that they're getting?
Well, I can point to how much people say it has impacted their health. So 54% of those who are getting this information say that it's helped them better understand their own health. So
That's impressive.
there's something is happening there.
large
There's
number
some
of people.
kind of
Yep.
education and learning happening.
Clarifying maybe of what they've heard someplace else.
Right, or maybe something they didn't necessarily know they had, or that like a symptom that they didn't think was anything but might be something, or maybe is nothing, right?
Yeah.
So giving that more, that better clarity around that is happening for a large share of the people who are getting it. A small share, about 12%, say that they're more confused about their own health. So there's a negative side there as well. But we also want to see about the emotional reaction, because it's one thing to understand your health and another thing to feel good about that understanding. Right. You might learn like that you have some condition that you didn't know you had, or that you're not taking care of yourself and that you need to do better. And so we ask people if that information was making them more or less worried about their own health. And we found that it's roughly equal shares. 22% say less worried, 26% say more worried. But digging into the age data, again, we see a really interesting trend where among ages 18 to 29, it's 36% say more worried. So it's leading to more negative impact in terms of emotional mental health among the youngest age group.
Oh, that's fascinating. We're here at Aspen Ideas Health. You were on a panel earlier today discussing the wellness economy. Tell us the sort of tenor and tone. You had a couple of folks up on stage there with sort of different viewpoints, but
It was great.
Yeah, it was a great conversation.
Very interesting conversation to follow.
Yeah, and I think it's really interesting to look at the different viewpoints that each of them were coming with from a journalism perspective. All of them had some kind of journalism background and the on the ground as an influencer. I think one of the most compelling things that I heard one of them say was that you need 6 seconds. You only get 6 seconds to capture somebody's attention.
Yeah.
Right, as someone is scrolling through their social media feed. And I think what's interesting is that when we tie it back to our data and we look at what we asked, what we found, 2/3 of people who are getting health and wellness information are getting it because they happen to come across it. Now, that's different from when you're getting health information from virtually any other source. You don't happen across health information from your doctor. You go to the doctor because you're sick and you say, "Doctor, I'm sick. What can I do?" You're seeking it out. Same thing if you go to WebMD or something like that. You're seeking out that information. But because you're on social media, just as a boredom or whatever other reason, and the algorithm gives you what it thinks you're interested in, you're just happening to get that information. That's an entirely different dynamic than that seeking out information dynamic.
I was telling Margaret earlier, I spent too long hovering over mountain goats climbing up mountains. That's everything in my feed. So I can imagine if it's a health issue, you're getting all sorts of information back and forth. Any sort of commercial application out of the work that you do is? We
are a nonprofit.
Sure.
We're not. We don't seek to monetize any of this work. But it's all about trying to help the public understand the world around them and their own views.
Fascinating topic. We could keep you here for a long time. Yeah. Now I'm really curious about the folks that are using it, and in your sample size and in the work that we do in healthcare. We take care of very diverse populations: age, gender, sex, sexual orientation, country of origin, language spoken, all of these things, and of course different health statuses. Do you have a sense of how heterogeneous or homogeneous the people who are using the influencers platforms are, and how diverse are the influencers themselves? Is there something for everybody, finding somebody they can relate to? Tell us a little bit about that.
Yeah.
That's asking a lot of your research, of course, but we're very, very curious about all this.
That is a great question. So in terms of the audience and who composes that audience, we did find some racial differences, racial and ethnic differences, where Black, Hispanic, and especially Asian adults are more likely to be getting health and wellness information than white adults. There's a very small gender gap, I think 4 or 5 percentage points, where women are more likely. that is, I think, it's interesting to hear the discussion today where it was focused largely on the impact of wellness on women. But we also made sure to include the fitness, the men who are doing workout videos and things like that, because that is a large part of this wellness space as well. And so I think because we included that, we got up to I think it's 48-53 or 48-52 is the percentage is the gap between men and women.
I was surprised by that. Somehow I assumed falsely, and that's what happens with assumptions. It would be far more female.
We do see that gender gap with the influencers themselves. 2/3 are women and 1/3 are men. But the audiences, we didn't see that as much. We also saw, and I think this is really telling to what the people you work with, we saw a pretty large, I think a 15 percentage points gap between the insured and the uninsured. The uninsured are much more likely, or not much, but they're more likely to be getting health and wellness information from influencers than the insured are.
Interesting. And do you have a hypothesis about that? I can jump to a conclusion, but are you not at the hypothesis phase
We
yet?
don't have any causal linkages between that, but we do know that the uninsured are less likely to say they're
Routine
getting
primary care.
Information from a healthcare provider. Yeah, they're less likely to get their annual checkup and things like that. In terms of the demographics of the influencers, we did not do that part. It's incredibly difficult to determine that, and so we did not do that. But one thing we did find is that 21% of audiences are getting one of the major reasons why they get health and wellness information from influencers is because they want to get that information from someone who has a similar background or shares their beliefs. And so that points to that people are looking for people like them who have some of their same experiences, maybe the same medical condition, maybe similar identity.
Sure, that's a common one, I would think. Yeah.
Well, walk us back to when you were collecting information about news. What did you do after the report? What other analysis got done about the data you found? Or was it done by independent groups or groups in conjunction with your group?
So we did a few follow-up studies. We looked at, and I don't remember all the numbers off the top of my head, but we looked at the support or criticism of Biden or Harris or Trump. There's some really interesting things in there that I don't fully feel confident enough because I haven't looked at it in 2 years. We also looked at different social media sites than we had initially because Blue Sky had just popped up, so we did an analysis of that. And then we essentially, we make our data to the extent that we can publicly available. And so I know that other researchers have started to use that. For this data set, this report, we've made our data set of who these health and wellness influencers are publicly available, and that's linked in the report itself.
Who they are. They know that you were.
I mean, they could look it up, yes.
Yeah. And that's all publicly available?
Yeah. Well, in the news influencers report, we didn't have as many resources as we did for this report. So we actually only looked at 500 news influencers out of a sample of 2,500. So we initially uncovered about 2,500 that met all those criteria.
Versus the 6,800 for this group.
And we found 6,800 influencers, and we were able to look at all 6,800 for news influencers. We took a sample of 500.
And we could take a look at the list as well.
And that list of 500 is available.
Okay.
Yeah.
I thought one of the interesting lines of discussion, and not surprising this morning, was the degree to which influencers are presenting or marketing products. The degree to which, if they are marketing products, that there's a transparency there. If they are partnering on behalf of another corporation, is all of that disclosed? What did you find in your review of that? And how important was it to the users? Maybe not so important, maybe very important.
Yeah, so we're still doing that research. I mean, that is a big undertaking.
We'll have to have a second conversation about this.
We have several projects lined up around that, including what the influencers themselves are talking about, what kinds of authority sources they're drawing upon, or, are they looking at studies or medical research or their own experiences? We're doing a little bit more of that, and that's more looking at the post level and the individual posts that they're putting up. We've collected about 500,000 posts that we're in the process of analyzing for that. And part of that research is also looking at the products that they're promoting, not the individual brands, but the kinds of products. Yeah. And the extent to which they're disclosing it. That's all, in the pipeline. We're still working on it. And one thing that I can say at this point is we initially thought we could just look at how many have the ad tag or a sponsor tag, and we realized pretty quickly that wasn't going to be sufficient, that we need to go beyond that, because for many reasons, sometimes it's done in different ways. Sometimes the partnerships are mentioned in different ways. Sometimes they're not disclosed. And sometimes it's not a partnership and they're just mentioning a product. And so we want to be able to speak to that broader set of practices instead of just that. And down the road, not ready for it yet.
How long is that road in terms of the additional analysis of the work that you'll be doing?
Yeah, for that news influencers study, we continued drawing on that data for probably about 8 months. And
that was when it was fresh.
When it was fresh, yeah. And then we asked follow-ups. We did follow-ups surveys last year, but we didn't do the influencer level analysis. For this, I would expect it to be a similar kind of timeline, but I don't want to put any promises around when we have all this out.
Yeah. Not a scripted question, but you've got my curiosity really aroused. I'm wondering, has the public health community figured out that all the public health messages we've been trying to get out to people for eternity, and to different groups, that taking on the role of influencer, or getting people to take on the role of influencer, might be a better strategy than the traditional approaches to education, outreach, getting materials, electronic or otherwise, in people's hands? Have you gotten any sense of that organizations who are designed to try to get people to influence their health lifestyle in a positive direction have taken roles in this environment?
I wish I had an answer for that. I don't know. But I can point to the facts that 1 in 5 of these influencers are doctors or nurses. That shows that there's at least some interest on the part of those individuals.
This is a viable mechanism to get messages out there.
Right. And they're amassing followings. They have at least 100,000 followers on one of these platforms.
I think you're absolutely right. Thinking about, is that a new role within the health organizations to really designate people who are good communicators, who also can relate to different population groups.
Yeah.
That should be an additional role into delivering care. In fact, that is a way of delivering health information, which is delivering care.
Which would be an important finding for Pew, given its sort of mission, right?
Yeah, and I think that's one of the reasons why we share all of our data and all our findings publicly, because we want to enable anyone to do additional research and follow up and use it to try to make things better. I think one caveat for all this that I would say is we ask people a whole set of questions about what behaviors or what kind of actions they should be taking to make their health better. Things like getting enough sleep, exercising regularly, managing their stress, and vast majorities said all of these were extremely important. And I don't think you'll be surprised that very few said they're doing extremely well at this. So there's real challenges on the part of the public to actually getting to that healthy point. Life is hectic. There's a lot of things going on. Things are stressful. It's very difficult, even with the best messengers, to get there. And not to be a downer here.
But this may be a step, right? This may be a step.
It could be.
People have their own timing, and I think very much in your own hands is different. I know we don't have a lot more time, but just maybe tell us a little bit about the Science and Society team.
Sure.
What's the domain or the reason for being? And I know we'll give you the short answer maybe at this point, because I know we're running out of time, but just tell us a little bit about that.
Yeah. So at Pew, we have some topically focused teams. We have a team on news information, which I spend a lot of time on, a team looking at religion and politics and social trends, family life, all sorts of different global trends. On the Science and Society team, we're mostly interested in the effects of technological change, scientific change, and public's attitudes and trust in different sources. So we have whole lines of research around climate change and energy. We put a report out about that in the last few weeks that showed people were becoming more pessimistic about the ability to avoid the worst effects of climate change. We have a whole line of research about trust in science, which has shown that trust in scientists hasn't rebounded fully from the pre-COVID era, though it has gone up. And this health line of research. Oh, and then also a whole line of research around AI and people's attitudes toward AI. In the beginning of this year, we published a post about people's attitudes toward data centers and their awareness of data centers and their concerns about them. And we're continuing to follow up on that. And so we like to look at how all of these things intersect. We're starting a project on the role of AI in healthcare and people's attitudes toward that. But a lot of this research is about how the public is responding to these things and what they're thinking.
Very important.
Well, Galen, we want to thank you so much. Thank the Pew Research Center for all the work that they do. We'll continue to follow your work.
This copyrighted program is produced by Conversations on Healthcare and cannot be reproduced or retransmitted in whole or in part without the express written consent from Community Health Center, Inc. The views expressed by guests are their own, and they do not necessarily reflect the opinion of Conversations on Healthcare or its affiliated entities.